Carpal tunnel syndrome is a painful hand condition caused by a pinched nerve in your wrist.
Did you know it can be cured in a 15-minute surgery? CBS 4 health specialist Kathy Walsh sat in on the operation that's done wonders for a local artist you found.
It has, and carpal tunnel syndrome, affects about 2% of the population. It's more common in women. The cause isn't known, but doctors say it is not brought on by repetitive motions such as computer work. This patient found relief at Parker Adventist Hospital. With quick, confident brushstrokes, VogelBoyd puts the finishing touches on beautiful watercolors. But for years, this artist has painted in pain.
I would wake up in the morning and I'd start shaking my hand and arm. I couldn't even feel. I was numb all the way up to my shoulder.
Barbara was diagnosed with carpal tunnel syndrome, pressure on the nerve in the wrist. It woke her up at night. She lost strength in her hands.
So I would have to stop painting. I couldn't drive the car.
Barbara tried physical therapy and depended on a leave. This January, she opted for surgery on her right hand.
Immediately after the surgery, my numbness was gone. I felt an instantaneous release of pressure in my hand. And honest to goodness, it was amazing.
All right, we're in on the button.
Now, Barbara is back at Parker Adventist Hospital having the same endoscopic procedure done on her left hand. Dr. In-Sok Yi makes a tiny incision in the wrist. He inserts a small tube containing both a camera and a cutting tool. The transverse carpal ligament is cut, releasing the pressure on the nerve. It takes about 15 minutes.
I let my patients start writing and typing almost immediately after surgery.
Barbara plans to be painting in just days.
I expect to feel like the bionic woman. I can't wait. And I will hopefully be pain-free and throw away the bottle of Aleve.
Barbara went home today, believe it or not, with just one stitch. Dr. Yi says, as with any surgery, there are risks, including bleeding, infection, and nerve damage. But he's done about 2,500 of these surgeries in 10 years, and he says the vast majority of patients have less pain than with traditional carpal tunnel surgery and a quicker recovery.
That's just fantastic.
Yeah, something to ask your doctor about if you're suffering.
Certainly so. Thanks, Kathy.
A very